Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I'm speaking with Kemlin Nembhard, Executive Director of Women's Health Clinic, a community health center based in Winnipeg, Manitoba. Women's Health Clinic provides a wide range of health and social services geared to the diverse needs of individuals, families, and groups in Winnipeg. How are you doing today, Kemlin?
Great.
Good, I'm glad. The first question is always to get you to tell me a little bit about your community health center, but I will highlight that I think you're one of the very few people we've had as a recurring guest. So it will be a refresher for people who may not know or have not seen that previous episode about the same day care clinic and the work that you guys are doing during COVID. Tell us more about Women's Health Clinic and the main aspects of your organization, the communities you serve, and the services and programs you provide for anyone who missed that episode.
Sure. So the Women's Health Clinic, we just finished celebrating our 40th anniversary. So we've been around for 40 years and a little bit. And we're primarily based in Winnipeg, but many of our programs actually do go across the province. And we started as a pregnancy and birth control counseling information service that was volunteer based and grew from there, which we still actually have that program, and grew from there. And I like to say we provide a full spectrum of sort of sexual and reproductive health for women, people who are, gender queer, non-binary. We do have a couple programs that we actually do support men as well, but primarily it's women, people who are non-binary, like gender queer. So, and we also have, so it's health, sexual and reproductive health, as well as wellness. So everything from, we have a birthing center called O'Damon, where it's midwifery led and it's unassociated with unattached to a hospital. I think one of the only in Canada. We have parenting programs. We have a grief and loss program for parents as well. We've got birth control, as well as we've got a health clinic, like a medical clinic. We also have an abortion clinic where we provide both surgical and medication abortions, as well as we also have a counseling program, an eating disorder program. We do health education, work in high schools. So we do a whole bunch of things. And I think we really like to look at health and wellness as, your health is a lot of things. So your mental health is part of your health. Your physical health is part of your health. Your spiritual health is part of your health, right? And so we like to look at it in sort of like really like a circle as opposed to like a line, right? And we also are a feminist agency that, is, we like, from an intersectional feminist perspective, right? So we serve a variety of people, that come from a variety of different circumstances. Many of our clients are newcomers or, racialized people, Indigenous people. So it's a pretty big mix. And like I said, we're primarily based in Winnipeg, but we also have many of our programs actually serve the province.
That circle you mentioned, that wraparound care, one of the most important things of the community health center model, and I love hearing about it every episode that I do. As you mentioned as well, you do both medical and surgical abortions, which is going to be, if no one knew from the title, sort of the crux of our conversation today. Can you tell us a bit more about providing these services and the diverse group that uses these services and why Women's Health Clinics sort of even started providing them?
Yeah, so we've always been a pro-choice agency, even from the beginning. Prior to abortions being legal in Canada, we used to provide people with references to, referrals to be able to get abortions in the States, which is what we used to do in Canada before they were legal. People had to get two letters from two doctors and a referral to a clinic in the States is what we would do. And then when it became legal in Canada, Morgenthaler, actually, Winnipeg is the second place that he opened a clinic in Canada. And so he opened one here, and it was pretty rocky at the beginning. He was arrested. Several people here were arrested by the government because it wasn't legal yet. And then when it became legal, then it was open here. Eventually, it was sort of bought by a nonprofit called Jane's Clinic. And eventually, in the early 2000s, Jane's basically approached the government to see, because it was a private clinic at that point. Morgenthal's was a private clinic. And so people had to pay up front. And so approached the government about the government actually funding abortion services outside of the hospital, so in a community clinic model, because it was already provided through our main hospital, the Health Science Center. And so after much negotiations and all that, so then the government then started funding us to provide abortion care for clients in a community setting. And so that's actually 16 years we've actually been doing that. And we provide, a full, like the full spectrum. So both medication and surgical abortions. So we have a couple surgical suites, and it's the same day. So you can get all your tests, and, like whether you need blood tests, ultrasounds, sorry, medical, just that, no, sorry, mental sort of block there, ultrasounds, and then you can actually get the procedure right there that same day. So yeah.
Wow. I did not know all of that rich history. And in all fairness, I definitely forget how recent those changes have been made, because like you saying the 16 years ago, I was like, that's no, I was alive. That's
Yeah.
mind blowing to me.
Yeah. I mean,
Um,
it was legal before then, right?
of
Like in
course.
1988, but yeah, just in terms of broad spectrum of availability, uh, that's taken time, right? So for many years, it really was predominantly available in hospitals.
Right. And I
Yeah.
find it interesting, like you said, that they, in the past, you had to go to the States if you were Canadian to get one. And a big part of this conversation is about to be the Roe v. Wade being overturned and how things have so
Change.
drastically changed.
Yeah.
So, as our listeners may know, in the United States, Roe v. Wade was just overturned, which no longer protects the right to an abortion federally, if I understand the politics. But I'm asking you as the expert, if
Mm.
you can describe some of the situational differences between what's going on in the United States right now around abortions and Canada's situation, as well as how our laws could change if we don't continue to advocate for abortion and women's healthcare rights in our own country.
Yeah. So I think, first of all, like our legislative system is very different than the States. So I think um I think it would take quite a bit more. It would take something different for it to be overturned in Canada, right? It's based on the charter, right? And so, um, and quite frankly, I think our Supreme Court is a lot less politically aligned and motivated than the states, than the Supreme Court in the US. And that plays a big role in decisions like that. And I think it's important to say that too. So that's the first thing. The second thing is, I think in the States, basically Roe versus Wade meant that access to abortion became legal federally in the States. And so even though it was, a lot of that stuff is the laws are made at the state level, right? And it goes from state to state. Basically that meant that there were protections across the country for access to abortion because it was legal, right? And so it was across the country. So it was legal across the country. With it falling means that now those decisions are made at the state level. So there's no longer this federal protection that is saying across the country, no matter what state you're in, abortion is legal, right? And so now what's happened is, when Now, I'm not the complete expert on the American situation because I wasn't even I was born when it when the president was set, but I was pretty young. So, but basically, when that came into effect, there were several states that had what they now call trigger laws on the books that were superseded by the precedent of Roe versus Wade. And so, which meant that, so a good example would be Michigan had a trigger law that was from the 1930s that severely restricted, and I believe it actually, I can't remember if it completely restricts it or like if it's completely illegal or if it just, just very, very severely restricts abortion in that state. And so once Roe versus Wade was turned over, states that have laws on the books revert to what was on the books prior to that. So there are a number of states, and I think it's 12 or 13, many of which were below the Dixie state, the Dixie line sort of thing, not only that have what they call trigger laws. Michigan is one of them. North Dakota is another one that automatically come into effect basically, and that severely restrict or completely restrict, like completely make access to abortion illegal. There are other states that, and it's like another 13 or 14 that had like state houses that were, I think, all Republican controlled, that had laws basically that they were waiting to pass if it fell, that would do the same thing, that would severely restrict access to abortion. And so, or make it completely illegal. And so I know maybe 3 weeks ago, I was, looking at a map and talking to, we had a guest speaker at our AGM we had a couple guest speakers actually at our AGM from the Arkansas Abortion Support Network, who showed a map of what it would look like if it fell, right? And I think it was 26 states. And like it's visually, it was really shocking because you could see that huge swaths of the country were basically going to not have access to abortion care, right? It's going to be like illegal. And so people would have to travel great distances in many cases to find access to abortion care. Like if you're driving, it would be hours, right? Many cases you'd probably want to fly. It'd be really far. And in particular, when we look at close to us in Manitoba, we're kind of surrounded by states that have these trigger laws. So the only outlier was really Minnesota. In terms of the difference, so that's kind of generally, I would say, the picture of the states. In terms of in Canada, so in this case, it's, the difference for us predominantly is that abortion is, while it's a right, it's a right of healthcare, right? And abortion is healthcare. And no longer have to go through those hoops and everything. But as with many things, medical is managed and controlled by the provinces, and so how that is delivered is different with each province and territory. So, as an example, in Nunavut, there's nowhere in Nunavut, as far as I know, that you can get access to abortion care. So, anybody that needs an abortion in Nunavut, you need to leave the territory to do that. And then, how it is done in different jurisdictions, it's like very different, right? Overall, I would say across our country, most abortion care is pretty much concentrated in urban centers, large urban centers. And so Manitoba is no different. The places that you can predominantly get an abortion, particularly surgical abortions, are either here in Winnipeg, where you can get it either at Health Sciences Center or through us at the Women's Health Clinic, or you can also go to the Brandon Hospital. So those are the three places you could actually get a surgical abortion. Having the abortion pill be legalized in Canada definitely helped a lot, because that's something the training for that is much easier to get. Um, and so, it's much easier for your general practitioner or a gynecologist to be able to have that training. And more, I think, have been getting that training, which means that, your general practitioner, regardless of whether you're in an urban center or a rural center or northern, may be able to provide medication abortion, right? And so there are more people that do, but it's certainly, access in Canada isn't equal, right? And particularly, again, if you're in rural or northern communities, it is not equal because generally speaking, you have to travel to find access, and that access becomes even more difficult depending on what your circumstances are. So, if you have to take time off work to travel, if the distance is really great and you have to travel overnight, you have to stay somewhere, more than a day, right? You have to take more time off work. You have to not only pay for your travel, whether that's plane or car or whatever, but then also you're paying for a place to stay. If you have children, you have to, figure out childcare. And then again, you may be missing work, right? Like there's all sorts of different things. If, for instance, someone is in a situation, of domestic abuse, and it's something that they don't necessarily want to tell their partner about, right? Um, then having to take having to travel for a day or two and explain that is difficult. I think it's also important to remember that there's still a stigma with abortion, unfortunately, which is, I think, ludicrous in this day and age. But so even um talking to people in your family or your peer group, many people don't do that because they don't necessarily feel comfortable or safe. And you know so that again puts another stress on it if you have to travel for a day or two or something, trying to explain that to people without being able to tell them. And then on the other side, that also is has to do with practitioners. Many practitioners aren't don't publicize that they provide abortions because there's still an issue of safety, right? And so, which again provides an issue around access, right? There could be somebody in your community that provides it, but because they don't publicize it for very good reasons, right? They may be worried about the safety of their family and for themselves. How can you find out that they provide it, right? um and then again, you know again, with that stigma, there are definitely some practitioners that refuse to provide it if you don't feel comfortable saying that to your practitioner, right? Like, so there's all these different issues, right? That um that generally access and that inequality of access has, like creates, right? And in particular, it hits people who are poor, marginalized, racialized people, indigenous people the most, right? Who often people who have less access to resources may also have already have had problematic experiences with the medical, you know, um, like sort of medical sector, right? Whether that's at a hospital or with doctors, and these are other hoops they need to go through and other things they need to deal with. So hope that made sense.
It's quite the laundry list of issues. It did completely make sense, but it is definitely a lot. It's a lot to swallow when you think about how something that, as you said, like it's ludicrous that there's the stigma. It should be easy. Abortion is healthcare, and yet there are all these reasons why it is difficult in Canada, even though it's legal in comparison to, well, like what's going on in the States right now. Which segues perfect to my next question, because you've mentioned, touched a bit on like healthcare specifically, and like training, and all of these different things. How could our healthcare system make abortion care more accessible or safer in Canada that our listeners might not even have thought about or considered, or considered advocating for, like, loudly?
Yeah, so in a few different ways. One, and I will say, our prime minister has been uh, really firm and strong in his support of not only choice, but access to abortion care in Canada, also supporting, people that may come from the States in terms of getting access to that. And I can't say enough how important that is, right? Like it's very, very important to have that leadership at, that level, right? And to be very open about that leadership. That is super important because that gives a message to practitioners, it gives a message to people in the community, it gives a message to, young people and anybody in our society who may have these questions, right? And I think that's important to hear from any political leader, right? And so, but particularly from the Prime Minister's office. So that's first. I guess in terms of some of the things I think is following up on that leadership is all across the country. We need leadership in terms of governments funding abortion care so that it's public, right? We like here at our clinic, we don't, as long as you have a Canadian medical card, you don't get charged, right? So you just it's healthcare, right? And that is particularly because it's funded through the province funds it, right? They fund us to provide a certain amount of abortions per year, as well as the hospital does that too, right? There are without that funding, then you end up with private clinics. So I know uh I think in Saskatchewan, in southern Saskatchewan, there's a private clinic, right? Which means that people have to pay. And that's again another barrier, right? So I think that's one thing, is that whether that's, and it could be both, funding through the provinces as well as, and territories, as well as through the federal government, to ensure that abortion care is funded, is super important, right? The second thing is that a lot of people don't know is that abortion care is healthcare, right? Sexual reproductive health is healthcare, right? And that should be taught in medical school. And it is not. To me, it's ludicrous that something like like abortions are not taught in medical school. And so that is also a huge barrier, right? Like one, if it's not taught in medical school, that tells you one thing, right? Like, so somebody that is interested in that care has to go out of their way to be able to like severely out of their way to be able to get that training. So that's the first thing. The second thing is that and it's particularly around surgical abortions is difficult. And to me, that's just that it doesn't make any sense, right? Because if we really want broad access to care, then you need as many practitioners as possible that can practice that care. And that basically starts at medical school, right? So to me, that is a big thing. So around, the colleges of physicians and surgeons that, and sort of not directing, but I think, and medical schools across the country need to actually make that a priority to ensure that practitioners can get that training. And it's one of the issues I know for us is in the past, even when we started providing care, and even when Morgentaler Clinic was here, there are very few practitioners. Like they used to have to, there were some points they had to fly in people from Toronto for some of the days that they had abortions, that they were providing abortions, because it's really difficult to get that training, right? And the way it is here is you actually have to be able to get into that training. It's usually in another clinic. To be able to get into that training, you actually have to have a job offer in a clinic. Like, so you have to have a job offer from us, for instance, to be hired as a provider before you get your training. And then once you have that offer, then you basically apply, right? So then the doctor has to take the time off. So they, at which point they're not making any money. So if they have a clinic, right? They're not making any money in their clinic because they have to take the time off and travel to do that training. And it's usually 2 or 3 weeks. And they're gone for that 2 or 3 weeks. And then, so they're, taking time away from their family, taking time away from their practice, right? And they pay for that, right? And so that's really, restrictive, right? And just in itself is really restrictive, as opposed to if it was actually taught through medical school, just makes it much more accessible, right? So to me, those are some of the big things that I think need to happen, is around government funding, both at the federal and provincial level, and funding. And I should just specify too, I think it's important to have both provisions in hospitals as well as in community setting, because there is a difference between going to a hospital generally and going to a community setting. And, I think anybody that we're all users of our medical system, and most people would probably prefer to go to a community setting as opposed to a hospital for something that is a day, it's a same day procedure, right? Whether, and for medication abortion, it's, you have to get your blood tests and, if you need your ultrasound, but it's a prescription, right? And so I don't know, I would prefer to go to a to a community clinic as opposed to a hospital for that, right? Um, so again, to me, it's important that these things are publicly funded, and that they're funded not only in hospitals, but also in a community setting.
100%. I'm just thinking, like, if going to a hospital feels also much less private than probably going to a much smaller place as well. And you're like you were saying, in those situations where you might not be able to disclose to your family because of stigma, or disclose even to your partner because of maybe a specific situation. I would hate to the risk of running into somebody by going to one of the major hospitals where you don't know who you're going to see would be just another level of stress that that person definitely does not need at this time.
Yeah.
Um, so as you've mentioned in the past, Manitoba is sort of surrounded by some of these trigger states, and it will directly end up impacting you. And I just wanted you to highlight how the situation in the states will directly impact women's health clinics specifically.
Yeah. So I think, again, looking at that map, you can see that in terms of access to abortion care, if we look at just in Canada, right? Like we already serve not only Winnipeg, but Manitoba. So people come from the north, rural communities, people come from Northwestern Ontario, people come from Saskatchewan from us already, as well as from North Dakota. So every year we probably get a handful of people from North Dakota already. And what I'm trying to say with this is that we're already kind of an island, right, in terms of access to publicly funded abortion care. And so one of the big worries that we have is that we may see a surge of people coming to us for abortions, because people are really, like, especially on the border, people are going to have to travel quite far to get to a state where it's legal. So, taking a plane to California, right? North Dakota, at least they're fairly close to Minnesota. And so, they could travel the 3 or 4 hours, depending on where they are. So that is our biggest worry, I guess, right? Is that we may be inundated with people that are coming north to get access to care. And this opens up a bunch of things for me, right? One is, I think it's important to remember that Canada's a tenth the size of the US. And so it's not realistic to imagine that, if we did get a huge surge, right? If people felt that was the easiest place to go, there's no way we could actually meet the full need of what people would, could potentially come north. And I think that's important to keep in mind. We would never turn anybody away, but I think it is important to keep that reality in mind. That's the first thing. The second thing is there are lots of issues that people will face too in being able to do that, right? You need a passport to come into Canada from the States now. So that is, a block for people. For people that don't have a Canadian medical card, we actually charge. For us, we charge, it's just to cover everything. It's about $600 Canadian, which is also a barrier for people. Now, having said that, my understanding is that in the States, in most cases, people are charged also. And my understanding is that what we charge is about equal to what people will get charged for the lowest gestation level. So this is one thing I did not understand until maybe 2 or 3 weeks ago, is that in many places, I think, or all the places in the States, you actually get charged depending on your the gestation. So and I think generally if you're, let's say 6 weeks, it's like $500 or $600, but it goes up to $8,000 to $10,000 depending how far along you are in the pregnancy, which is crazy in itself, right? For us, it's just a flat rate. So I think the hospital charges quite a bit more than we do. And so I can't speak to what they charge, but so those are the things. Those are the things that I would worry the most about, in terms of actually providing care. The only other thing I would also worry about is, and we're seeing it already, is um, the level of misogynistic, awful rhetoric that has been fomenting and has just, this has kind of blown the top off, right, in the States, is incredible. And, to say that sort of rhetoric, the sort of political discourse that happens in the States doesn't impact us in Canada is naive to think, like it does. And we're seeing it already, right? So the morning that, the Supreme Court overturned Roe and Wade, which was last Friday already? Yes, last Friday. By the afternoon here in Winnipeg, there was an anti-abortion rally organized for the Saturday. And, while there weren't a whole bunch of people there, obviously that sort of rhetoric emboldens people here, right? And it's also important to keep in mind how that, along with that rhetoric also comes a lot of violence, right? We've seen it before, right? Here in Winnipeg in the late 90s, a doctor was shot in his house, like an abortion provider. And we cannot forget that, right? And in the States, it's a lot more, it's just a lot more really awful in terms of that crazy rhetoric and violence around that. And again, that could definitely have an impact here, right? And so I think it's really important to keep those things in mind, right? Keep those things in mind for people seeking care, but also the providers, right? And again, kind of going back to what I was saying earlier, there's a reason why many providers don't publicize that they provide abortion care. And that's exactly it, right? Is that they're worried about their safety and the safety of in their clinics as well as their families, right? So
as you mentioned, like there are several things that will most likely impede at least a whole drove of Americans coming over to your clinic. But are there any concerns that Canadians or the people of Winnipeg might have about the impact on your community health center or other abortion service providers, considering that, as you've said, you're already like at a capacity superseding that? So should any Canadians have any kind of concerns, or be vocalizing those concerns maybe to MPs, MLAs, government officials?
Yeah, that's definitely a worry for us. We've started to try and put some plans in place in case that happens, because again, we don't know what's going to happen, right? Because it's still early days. But yeah, absolutely. What I would say is definitely please contact your MLAs, your MPs, your MPPs, the premiers, and the prime minister, and let them know that this is a priority, that abortion care is health care, and that abortion care should be accessible to anybody that needs and wants and chooses to do that, regardless of the circumstance or where they live, right? And that it should be publicly funded, right? um I think they need to hear from us. There have been lots of studies that have, not studies, but polls and everything that do them regularly around looking at support for abortion, and it's in Canada it is very high. But I think it doesn't hurt for them to hear from citizens directly. We have developed a sort of letter that people can, if they go to either our website or our Instagram or our Facebook page, I think they can download it, and obviously they can put it into their own words, but just to kind of give people some wording that they may want to use in terms of when they're writing their MLAs, MPPs, or MPs.
Perfect. So as we start to wrap up on our last two questions, just before I get into those, were there any other ways that our listeners could directly support either abortion care service providers, or specifically support the Women's Health Clinic, other than downloading that letter, contacting any government officials? Was there anything else?
Yeah, absolutely. And I would say, always support your local abortion provider, right? If there are community clinics in your community, make sure to reach out to them. I'm sure that they probably take donations, and there may be other ways that they can use support, right? They may take volunteers. For us, we definitely could use support through donations, because we do, like I said, we do already provide abortions for people that don't have Manitoba medical cards or don't have Canadian medical cards, in which case they have to pay, or people that are coming great distances from out of town. And so we do have a fund that is solely donation driven to help people offset some of those costs. And so um, I would encourage people, if you're looking for a donation, please, we would love to take your donation for that. We also have, if you don't want to necessarily give money per se, we also have a bunch of great merch on our site. And we're coming up with new things all the time, like t-shirts and all sorts of things. So, you could also wear a great support on your body. And that would also support the work that we do. And I'm sure there are other abortion providers, like other community clinics across the country, that also have similar things. Yeah.
I will be decking out myself and all of my friends. Don't even worry. Don't even worry. You'll see my name pop up on that donation list.
Awesome.
So, what particular gaps in services and supports do you see in the community that you serve in regards to abortion care or beyond? And do you have any thoughts on how provincial and federal government policy changes or funding could help address those gaps, further extrapolating from all the other things that you've already highlighted so well?
Yeah. And I think most of them, I think I kind of touched on, but I think one of the big things for me is around leadership, right? And so how our leaders speak about this is very important. One, that they need to talk about it, right? They need to talk about it, and then they need to talk about it in a way that is not only supportive, but is absolutely 100% saying that, that not only is this a right, but that they actually support this, not only with words, but with actions and with funding, right? That is super important. And so I think we need that from all of our leaders, whether they are, from the prime minister to and premiers to, leaders of other political parties, right? So whether they're the opposition in the House of Commons or the opposition in your provincial legislature, right? I think having that is super important because, like I said, I think the rhetoric that's happening down south has emboldened and will continue to embolden um, people who constantly want to restrict access to abortion care. And even though they are a really small voice in the community, they they shout, right? And so um, we need to make sure that the majority voice is heard. And the majority voice is that abortion care is health care, and that we support full access to abortion care across this country, no matter what your circumstances or where you are, right? And we need to all keep saying that. And leaders need to say that. That's the first thing. And again, I think the second thing is around funding, right? Um, Whether that's provincial funding, and again, because healthcare is provincially administered, definitely there needs to be provincial funding across the board, provincial and territorial funding, in across the country, as well as federal funding for that. And I think it's super important, again, to support our public health system, in the sense that it shouldn't be provided, I think it's much better if it's provided through, like, whether it's a community health clinic or a hospital, like something that is publicly funded, so people do not have to pay when they come through the doors to get access to that service, right? Um, and so I think that is one of the primary things. The other thing is, again, around medical school, right? And, this is something that should be taught, along with a lot of other sexual reproductive health, should be taught in medical school, right? And so that's something I think definitely medical schools, colleges, physicians, and surgeons across the country that um, need to actually push that. This is something that needs to become a regular part of your education for a doctors, right? That a doctor doesn't have to, someone who is, a medical professional that is either practicing, primary care, doesn't have to sort of really bend over backwards and um, go beyond to be able to even get the training to provide it, right? Like, this should be something that every medical practitioner should be trained on.
100%. Up until we spoke about this, I didn't realize how many levels of difficulty there was for something that is supposed to be healthcare and accessible to all women across this country. So when you make it seem like you don't want doctors to do it, you're impeding women from getting it done safely, and
Exactly.
it's a domino effect.
Yeah.
So for Women's Health Clinic, what do you think your experiences say around serving this client base and others? And what does that say about the ability of community health centers to adapt to the emerging social and public health issues and the importance of CHCs within our health and social service system?
Yeah. I mean, I think that when you look at the CHCs generally, so even if you look at uh abortion care with us, right? We get funded to provide 1,600 per year. We actually generally provide between 2 and 2,200 per year, right? And we've done that. Not, I think we should get funded to provide that much and more, because obviously the need outstrips the funding that we get. And again, we are not the only place in Winnipeg that provides them, right? So there's definitely a need that is much greater than what is funded, right? And so, I think, but I think what it shows is, because we're not a hospital, right? Because we're not, and this is, I think, the case with community health centers, right? Because we're not hospitals, right? Because we are generally very connected to the community, whatever community we serve, right? Whether that's geographic, or whether that is, like a characteristic of some sort, right? Like, so we are generally much more able to be nimble, and adapt, the services we provide, but also how we provide those services to try and meet the needs of the community, right? And I think that this is a perfect example, is that it demonstrates that, I think, is that because we are smaller, right, and very much directly connected to the community, it allows us to do that, right? Which larger institutions don't really have necessarily that, um don't necessarily have that flexibility as easily, right? And I think that's very important. I also think, community health clinics provide service in a really cost-effective way, right? That, and generally speaking, community health clinics provide service for clients in a much more wraparound way. So, often treating clients um, as a full, um, like a whole person, right? So not just the one service that they're looking for. And so, I think that, that's super important, right? And that just generally provides better care, I would say. And, quite honestly, I think when we're looking at providing primary care, like community health clinics are probably the most efficient and effective way of doing that in a way that provides great quality care.
100% wraparound care.
Yeah.
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 So if anyone listening wanted to learn more specifically about Women's Health Clinic, buy some of that merch, find that letter, what website would they go to?
So just go to www.womenshealthclinic.org, and you'll find us there. And you can also find I can't remember, I'm sorry, off the top of my head, I can't remember our Instagram and Facebook addresses, but if you looked us up, you would find us easily on Facebook and Instagram too.
Perfect. Wonderful. I want to thank you again for this very important and educational conversation today, Kemlin. Thank you so much.
Absolutely. Thank you so much for having me on. It's a pleasure as usual. And if there's anything else we can help you with, I'd be happy to do that.
100%. Thank you.
No problem.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.